Patients often come to me with signs of upper facial aging, which is really, doctor, my eyes don't look like I feel anymore. I look in the mirror and I don't know what's going on. And most commonly patients think, well, I see that there's some loose skin here and some bags here, so take out the skin and take out the bags and it's gonna make me look kind of how I want, how I feel. But the challenge is, the face as it's aging is typically not doing what we think. It's actually shrinking on the upper side of the face, both the bones and the fat that's there are kind of shrinking down, and the lower part of the face is kind of expanding with patients having jowls and neck bands. So a very common part of my rejuvenation strategy is fat grafting, and that's what I'd like to talk about today. Most commonly, the procedures that patients are expected to have are skin removal and fat removal, and these are subtractive techniques that might make the skin look a bit tighter, but it doesn't really achieve as natural and youthful of a result as possible, as at the same time adding a little bit of very subtle and artfully placed volume, typically to the lower lids, cheeks, temples, and brows. So let's talk about what are the options for volumizing that area. The most common, I probably would say, and relatively easiest is fillers. You know, these are hyaluronic acid fillers, generally something like Restylane or Juvederm that patients are familiar with. And the benefits are, this is relatively inexpensive, can be done in the office relatively quickly, and so a pretty fair, easy recovery. The downside, however, is that these procedures have a very high rate of cosmetic complication, meaning looking unnatural, maybe kind of puffy, some swelling that's kind of present. And I think that's what most people associate when they think of, oh, I don't want to have anything put in my face. They kind of think of this filler look. Fat, on the other hand, actually achieves even better results that are more long-lasting and more natural looking. And that's why I prefer to use fat grafting. Now, the process is, I typically will harvest some fat from elsewhere in the body, usually the thighs or the abdomen, using just a little poke in the skin so there's no additional incisions. I harvest some fat, and at the same time as we're doing other surgical techniques, I process it and then very carefully inject it without any additional incisions onto the face through a few little poke holes, typically a poke hole here, one here, and one there. And through those holes, I'll go ahead and restore some of the facial shape that actually is lost with aging by giving subtle projection to the cheeks, filling in the hollow temples, and giving a little bit into the brow. Now, the beauty of this procedure is that nobody afterwards looks done or would be able to tell that they've had anything done. The location that I'm adding this volume is a location that the face is already kind of shrinking on its own. And so the beauty of this procedure is it just makes somebody look more natural. And one of the big concerns I see on patients' face is, Dr. Samimi, what are you talking about putting fat into my face? That sounds crazy. I don't want to look like a weirdo. I don't want to do it. But with my experience, I've figured out that actually this is one of those rare times when adding this additional procedure gives you a more natural result. Because removing more tissue, which is what classic eyelid surgery and facial surgery is not a natural thing to do with a face that's already kind of shrinking. And so the fat grafting is just adding a natural maneuver to help us reach our goals. And because natural and natural adds up to more natural, and so the results, as you'll see with the before and afters that I'd like to share, is just a very subtle, very natural result. And so here you have patients where if you look at the before picture, you can start to see that the upper face kind of looks a bit saggy, but you wouldn't really know why until you start thinking about the fact that the temples are hollowing, the cheeks are sagging, and the brows are kind of becoming flat. In these after photos of these patients, you see that something just looks rejuvenated, rested, more youthful, but they still look like themselves, just a younger version of themselves. And this is one of the reasons why I love adding fat grafting to my procedures, even when patients don't come to me asking for it. One of the common questions I get from my patients is, Doctor, how long does this fat grafting last in my face? And interestingly, Unlike fillers, which usually go in and are there for anywhere from 6 to 12 months to a year or two, the fat grafting is the longest lasting treatment that we have. The fat, like I said, starts to show its effect only starting at about month 6 to 12, and then in my experience has continued to look great for years to come. The thing that patients must know is that no procedure stops the aging process, and so the face does continue to age regardless of what we do. But the nice thing is this kind of adds a bit of a reset. So although nothing lasts forever, you will look much better in 5 or 10 years having done the fat grafting procedure now than had you not done it. All procedures and techniques have their potential limitations and complications, so I wanted to share with you those theoretic ones for fat grafting. Number one, the limitation, or maybe challenge to some degree, is that the result is not immediate. In fact, the fat actually starts showing its positive effects at about month 6 to 12. And so it takes a bit of patience on the part of the patient to kind of see the benefit. Limitation number two is that the fat itself is to some degree unpredictable. We don't know exactly how much we put in and how much it's going to take. And so I'm always on the more conservative side because you never want to overcorrect and maybe potentially have things look a bit more puffy. Other potential complications are that, if you have a lump or a bump form, like happens very commonly with fillers, then it can be more challenging to get rid of because then it's kind of part of the body and that would need to be kind of shaved down with a revisional procedure. Lastly, like all procedures on the face, anything that's done around the eyes does have a theoretic risk for vision loss. Now, all these complications sound a bit scary, but I'm pretty proud to say that I've been doing this at the time of videotaping for over 10 years, and I haven't seen any of these complications. I've only seen patients with very natural, very great results. And the beauty is we kind of have something to look forward to about between the months 6 and 12 after the eyelid surgery, which typically looks great at about 2-3 months, but then this is an added benefit that makes people start to look and feel a lot better. To summarize, there's a few reasons why I prefer and love fat grafting as a complementary procedure to a lot of eyelid and facial procedures. Number one, it's something that can be done at the same time as the surgery that we're doing to enhance the result. Number two, it's the most long-lasting treatment that we have for adding volume to the face where the areas are kind of shrinking. Number three, it really is a tool that I have to get patients more natural results. And I'm obsessed with a few things in my practice. Number one is delivering safe results, and number two is natural looking results. And this procedure in my hands really kind of fits the bill, and it's beautiful to see the face continue to kind of blossom and look better and start glowing at the 6 to 12 month state after surgery. It's one of the things I love seeing when I see my post-ops at around 6 months after fat grafting on the schedule, because I know they're going to start glowing.